This is Population Health Weekly. We bring the science to your street. One small habit, one clear choice. Right where real lives meet. Every voice, every choice, every truth that we share. Public health is
Opinions are plentiful. Evidence from communities is not.
you to stay healthy.
Project managers, field staff, and on ground health workers know this best. A drone saves lives only if the cold chain holds. A telemedicine platform is worthwhile if connectivity and trust exist. And a local vaccinator is the one most likely to administer doses to your children on a snowy day. Today, we accompany a keen observer on a journey across continents to ask what actually works, for whom, and at what cost. The evidence awaits.
If we dare to listen
Welcome to Population Health Weekly with me, Shahnur Azhar. So far in the series, Click, Care, Connect, we have commented on how digitalization is driving healthcare and its supporting regulations. In the third episode last Friday, we wondered if history of infrastructure development is repeating itself. And if it is, can we do better this time? Today, in part 4, we bring three digital health stories from around the world, taking you all on a bit of world tour. But first, hello to my co host, Erin Rodgers.
Hi, Shanor. It's good to be here. Should I fasten my seatbelt with you taking us on this world tour?
I thought you already have it on, Erin.
It just takes seconds to snap back. But today I will also be presenting our fortnightly segment in which we put the spotlight on an issue that we think should be getting more attention than it's currently getting. Shanor, where are we heading to first?
The observer begins from the vast plains of northern India, Erin, where the road from a small town to the nearest specialist hospital can take an entire day. In a modest primary health center, a nurse sits before a screen. And on that screen, a cardiologist from a city hospital hundreds of kilometers away examines a patient's ECG in real time. This is eSanjeevani, India's national telemedicine platform, now the largest of its kind in the world. And the numbers are staggering. As of early 2025, eSanjeevani has facilitated over 43 crore or 430 million free teleconsultations, connecting patients in over 131,000 health centers to specialists in more than 16,900 hub hospitals. The platform has trained and onboarded over 231,000 healthcare providers. In 2023, it upgraded to incorporate AI based differential diagnosis, which by 2025 had been expanded to cover 300 symptoms with branching logic that integrates patient's age, gender, and language. Studies show that 75% of beneficiaries are satisfied with the service. Yet the limitations are equally instructive. A study in Kerala found that while satisfaction is high, barriers remain, including digital literacy gaps, uneven internet quality, and the need for in person care that telemedicine cannot replace. The platform has scaled to an astonishing degree, but scale alone does not guarantee equity. The knowledge gaps regarding the value of digital health platforms for different stakeholders persist. For a semi urban family like Al Rashid's introduced in episode 1 of this series, this service is a lifeline. For a rural farmer with no smartphone or reliable signal, it remains out of reach. The lesson here is that even the most ambitious digital health program must be accompanied by investments in connectivity, training, and alternative pathways for those who cannot access the digital front door. As the observer moves southwest and arrives at the hills of eastern Rwanda, she looks out over the landscape of terraced green slopes and red earth roads that turn to mud during the rains. Below, a health center clings to the side of a valley, its cold chain equipment humming, waiting. In the distance, a small white drone descends through the mist, carrying blood products that would otherwise take hours to arrive by road, if they arrived at all. This is Zipline's drone delivery network, launched in 2016 and now a global benchmark. The evidence is striking. Studies have documented up to 55% reduction in maternal deaths caused by postpartum hemorrhage in areas served by the service. In 2024 alone, Zipline delivered over 76,000 vaccine doses to rural communities, enough to fully vaccinate nearly 6,000 children. Delivery times have been cut from hours to minutes, with median blood delivery time by road at 120 minutes compared to 41 minutes by air. One study reported about 22% reduction in maternal deaths attributable to the program. But even this remarkable success comes with caveats. Independent evaluations confirmed significant improvements in health outcomes, reduced maternal mortality, fewer stockouts, increased immunization coverage. Yet, the model depends on a network of distribution hubs and reliable power, and its high upfront costs have limited expansion. The question is not whether it works, it does. The question is whether it can be sustained and replicated in settings where resources are even more constrained. A model that saves lives in one context may struggle to take root in another without the same infrastructure, political will, and international support. The observer's journey ends in southern Spain, in the whitewashed villages of Andalucía, where olive groves stretch towards the horizon and the afternoon heat shimmers over cobbled streets. Here, an elderly woman with chronic heart failure does not travel to the hospital for every checkup. Instead, a nurse visits her home with a tablet, and her cardiologist reviews her vital signs remotely through a platform called Salud Responde. This service, launched by the Andalusian Health Service or SAS, is a consolidated telemedicine model with multi channel access, designed to respond to the needs of more than 8 million people. It offers telephone consultations, remote monitoring, and appointment management, all integrated with primary care electronic health records. Studies have evaluated its effectiveness in reducing hospital admissions and improving quality of life for patients with chronic conditions. A randomized clinical trial found that adding home telemonitoring to an integrated care model for patients with advanced chronic heart or lung diseases decreased mortality and reduced hospital and emergency admissions. Andalucia's model is the most comprehensive of the three, seamlessly blending digital tools with an already well established public health system. Patients pay nothing. The service is fully funded by the regional government. But even here, challenges remain. Broadband gaps persist in the region's most remote mountain areas. Elderly patients, despite training, sometimes struggle with the technology, and the costs of scaling and maintaining the system are substantial. The Andalusian experience shows that universal public funding removes financial barriers, but technology and human adaptation remain challenged everywhere. It's a reminder that even the most advanced health systems must continuously ask, who is still being left behind? Three countries, three income levels, three different approaches. India's telemedicine platform is vast and free, but limited by connectivity and literacy. Rwanda's drones are fast and life saving, but expensive and hub dependent. Andalucia's integrated network is comprehensive and publicly funded, but costly and not immune to rural gaps. Each succeeds in its context, each has its trade offs. Next week, the digital stethoscope gives its verdict. Join us.
Shanor, I can appreciate that our observer was not just keen, she was very smart too.
You mean smart because of her dark glasses and all weather shoes? Or her landing in Spain on the weekend to celebrate the Football World Cup win?
Oh, well, because of all of that, actually. And now, having returned to Andalusia, it's time for the Spotlight, a fortnightly segment on an issue we think should be getting more attention than it's currently getting. Europe on fire, the new normal we refuse to see. Europe is the fastest warming continent on Earth, heating at twice the global average. June 2026 delivered the continent's hottest June on record for Western Europe, with average temperatures hitting 20.74 degrees Celsius, more than 3 degrees above normal. over 410 million people endured temperatures exceeding 35 degrees Celsius, surpassing the 320 million affected during the catastrophic 2003 heat wave. France's 14-day heat wave was even more intense than that of 2003, which claimed 15,000 lives in France alone, with temperatures above 40 degrees Celsius recorded 114 times, beating 2003's 87 instances. The human toll is staggering. Across 2022 to 2024, over 181,000 Europeans have died from heat, with 62,775 deaths in 2024 alone. Public health experts consistently classify nearly all heat-related deaths as preventable. The impact is worsened by rapid urbanization and aging populations, but can be mitigated through early community warnings, cooler cities, and prepared health systems. The challenge? European buildings trap heat but cannot shed it. Power grids buckle under 14% demand spikes. Schools, transport, and health systems are not designed for this. World weather attribution scientists confirm such heat waves would have been virtually impossible without climate change. The future outlook is grim. Under current warming trajectories, heat-related mortality could increase by 103 to 135 deaths per million people annually by the year 2100 for every degree of warming, with Western and Eastern Europe being hit hardest. The WHO launched new heat health action plan guidances in June 2026, but experts warn that without urgent adaptation investment, Europe's summers will only grow more deadly. The window for action is closing fast. That's all from the Spotlight and Population Health Weekly. I'm Erin Rodgers. Join us next week, listeners.
Technical support for this show is provided by Wahab Shahid. Podcast logo, theme music, creative and production advice is given by Imran Babar. Erin Rodgers is our editorial associate. Population Health Weekly is led by its listeners, and they are invited to participate in any competent way they can. If interested, email us at info@ideas.org.s, info@ideas.org.es.
Subscribe to our YouTube channel, Population Health Weekly, where you can also post your thoughts, comments, and imaginations. You can also subscribe to our monthly newsletter on our website, ideas.org.es. It's free. You can also donate to us through ideas.org.es and the hosting platform rss.com. All contributions will be dedicated to improving the quality of this show. The transcript of the show will be available as soon as it's posted via rss.com. If Population Health Weekly sounded interesting to you, then spread the word.
Special thanks to Junta de Andalucía and Gobierno de España for their support to autónomos that made this production possible.